There are 10 ways that cannabidiol oil may improve your well-being. 1. Offset anxiety and depression. The ability of cannabidiol to relax is possibly its most well-known result and the reason its use is so widespread in such a large number. A study has examined the anxiety levels of 57 participants in a public speaking test. Some people received placebos, and others were given 150 milligrams, 300 milligrams, 300 milligrams, or 600 milligrams CBD before their speech. The people who took 300 milligrams of CBD experienced significantly fewer anxieties during the testing than those who received a placebo. Interestingly, those who received 300 or 600 milligrams of CBD were more anxious during the test than those who received the 300 milligrams of CBD group. Additionally, at the very least, one mouse study revealed that CBD produced effects similar to imipramine, an antidepressant. Human trials are required, however, to determine the possibility that CBD can trigger this exact antidepressant effect in our body. Please subscribe to have 10 years of luck. 2. Treat select epilepsy syndromes. In certain instances, it is possible to use cannabidiol to treat epileptic seizures. The Food and Drug Administration, FDA, approved the use of CBD under the brand name Epidiolex to treat seizures resulting from Lennox-Gastaut syndrome and Dravet syndrome, two rare types of epilepsy in patients that are 2 years old. 3 studies that have been thoroughly vetted provide the evidence needed to support this FDA's choice. In these studies, 516 patients with Lennox-Gastaut syndrome or Dravet syndrome were treated with one of 2 treatments, Epidiolex and a placebo. Epidiolex is a medication that, when used in conjunction with other prescription medications, reduces the frequency of seizures compared to a placebo. 3. Reduce PTSD symptoms. In a study from 2018 published in the Journal of Alternative and Complementary Medicine, 11 people suffering from post-traumatic disorder, PTSD, took CBD in addition to regular treatment for psychiatric disorders for 8 weeks at an outpatient clinic for psychiatric patients. 10 of the 11 experienced decreased PTSD symptoms. Cannabidiol is generally well tolerated, according to the study authors. Margaret Rajnik, a doctor of nursing practice with experience using medical cannabis, as well as CBD, insists on the necessity of combining therapy with cannabis of any kind or CBD to treat PTSD. There is an amount of therapy needed for PTSD, she states. But CBD will give you that little bit of decreased anxiety. 4 other human trials from 2012 to 2016 suggest CBD reduces PTSD symptoms, although some include THC, or tetrahydrocannabinol, the main mind-altering element in cannabis. If THC and CBD are in sync, they produce what's known as the entourage effect, complementing the benefits of each other and increasing their potency. In this case, for instance, taking the same dose of THC and CBD can help reduce THC's high from THC, and a tiny amount of THC coupled with more CBD will enhance CBD's effects. 4. Treat opioid addiction. Certain studies, preclinical animal and human clinical trials suggest CBD may be helpful to patients who depend on opioids. In one of these studies, researchers conducted a study in which they administered CBD to those suffering from heroin addiction disorders. In the course of a month, CBD dramatically reduced the heroin user's cravings for cues, withdrawal anxiety, the resting heart rate, and the levels of salivary cortisol. No adverse side effects of any kind were discovered. Other studies show CBD is beneficial in reducing various medical and psychiatric symptoms, such as insomnia, anxiety, and pain, among patients suffering from substance abuse disorders. These findings suggest that CBD might be a successful treatment for addiction to opioids. But more research is required. 5. Alleviate ALS symptoms. Amyotrophic lung sclerosis, ALS, is the condition that causes nerve cells in the spinal cord and brain to weaken, leading to the loss of muscle control, which becomes more severe over time. It's still unclear what causes ALS, though it is possible to inherit the condition in some instances. There is no cure for ALS, and there are just 2 FDA-approved medicines to manage ALS symptoms. Studies suggest that people with ALS may benefit from the effects of the entourage created through the combination of CBD and THC, like those with PTSD. In a study conducted in 2019, participants received a mix of THC and CBD in various doses based on their requirements and preferences. People suffering from mild, moderate, or severe spasticity, muscle stiffness and tightness, caused by ALS experienced very high levels of satisfaction with the treatment. And those with severe or moderate spasticity reported more satisfaction than those with mild spasticity. 6. Relieve unmanageable pain. 2005 was the first time Canada authorized the usage of Sativex, mouth-to-mouth, absorbed by the oral lining, spray with equal amounts of THC and CBD to treat central neuropathic pain. In 2007, Canada approved the use of the drug again for pain from cancer that did not respond to other drugs. While continuing research conducted in the US indicate that cannabidiol is effective in treating non-cancer and chronic pain. In a study in 2020, the researchers conducted a study in which they administered CBD directly to a subset of patients suffering from an asymptomatic peripheral neuropathy, a result of the spinal cord's nerve damage, and another group suffering from similar conditions received the placebo. The results showed a significant decrease in sharp, intense sensations and cold, itchy sensations for those who took the topical CBD compared to those who took the placebo. None of the participants reported any adverse negative side effects. If it is applied by way of a topical application, CBD oil doesn't affect the systemic problem in the same way as if it was in the bloodstream directly. However, CBD oil applied topically is more targeted and targets pain in a particular region. Because it's more immediate and specific, it could have a more significant impact. Please don't forget to subscribe to grow our YouTube channel. 7. Ease diabetic complications. For starters, tests on human cells found that CBD helps reduce the effects of high glucose levels on other cells in the body, which typically precedes the development of diabetes and various complications. Researchers concluded that with further studies, CBD could have significant benefits when used in patients with diabetes, diabetic complications, and plaque buildup in artery walls. In another small study, 13 patients with type 2 diabetes who weren't on insulin treatment were given both CBD and a placebo, in place of insulin. Researchers found CBD decreased their resistin levels, which causes resistance to insulin, the protein that regulates sugar levels, and increased the glucose-dependent insulinotropic peptide, a hormone that ensures a sufficient release of insulin from digested food, compared to their baselines before they started the test. These results suggest CBD could be a natural treatment for diabetes by helping the body regulate insulin-related hormone levels. 8. Protect against neurological disease. Studies in the preclinical and clinical stages show that CBD is an antioxidant with anti-inflammatory properties. These properties are believed to offer significant neuroprotection or protection from various pathological diseases. Some preclinical studies have suggested that CBD could have beneficial actions against Parkinson's disease, multiple sclerosis, and Alzheimer's disease. Ischemia in the brain and Huntington's disease also were studied. However, the results were not reported. More clinical studies are required to prove CBD's effectiveness when used as a treatment for these conditions. 9. Inhibit arthritis symptoms. Arthritis causes the degeneration of the tissues within and around joints. There are many kinds of arthritis, and symptoms can include stiffness, pain, and loss of mobility. The treatment for arthritis usually focuses on relief from joint pain and better functioning. A study in 2006 revealed that Sativex, a CBD-based plant-based medication approved in the United Kingdom in 2010, promoted statistically significant improvements in sleep quality, movement, and rest during rest in people suffering from arthritis rheumatoid when compared to placebo. It was the first controlled study of Sativex as a treatment option for rheumatoid arthritis that involved the treatment of 58 patients. CBD was discovered to have the ability to relieve pain and the ability to inhibit the activity of the disease. In 2018, as part of the study of localized treatments, researchers gave the synthetic CBD gel in 250 mg or 500 mg doses per day or as a placebo to patients suffering from knee pain caused by osteoarthritis. The patients also stopped using other anti-inflammatory medication or painkillers except for acetaminophen before and during the study.